Pink eye. We've all heard of it, right? It's that itchy, red, sometimes kind of gross thing that gets kids sent home from school in a heartbeat. But what's really going on behind that redness? Is it always as contagious as we think? Well, in this explainer, we're going to pull back the curtain and get a much closer look at the real story behind pink eye. So what is it? An allergy? Some kind of bacterial thing? A virus? The truth is, pink eye is just a nickname. The real condition is called conjunctivitis, and figuring out what's causing it is absolutely everything. So let's start digging. All right, so to figure out what's going wrong, we've got to first understand what's supposed to be going right. So what exactly is happening, anatomically speaking, when an eye turns pink? The official name, conjunctivitis, actually gives us our biggest clue. It's all about the conjunctiva. Now, this is a super thin, totally clear membrane that acts like a protective film over the white part of your eye and the inside of your eyelids. When that film gets irritated and inflamed, the tiny blood vessels in it swell up and become way more visible. And boom, that's what gives you that famous red or pink color. And you might get it in just one eye, or it could start in one and then decide to jump over to the other. It really all just depends on what's kicking off that inflammation in the first place. Okay, so if conjunctivitis is just inflammation, what's actually pulling the trigger? This is where it gets super interesting, because not all pink eye is the same, not by a long shot. Let's take a look at the usual suspects. Get this. A massive 80% of all cases are infective. That means they're caused by a virus or bacteria. And this is so important because this is the contagious kind of pink eye, the one that spreads so easily. It's exactly why you need to know what you're up against. So within that big infective group, we have our two main players, viral and bacterial conjunctivitis. Viral is by far the most common, and it's the one that spreads like wildfire through schools and offices. Bacterial, on the other hand, shows up more in kids and has some, well, let's just say it has some pretty distinct symptoms, like that thick discharge nobody wants to see. Diving deeper, the viral version is the #1 offender, responsible for about 80% of all infectious cases. The main culprit is usually something called an adenovirus, which is actually in the same family of viruses that gives us the common cold. That's why it's so contagious. In some rarer cases, other viruses like herpes or even varicella zoster, yep, the chickenpox virus, can be the cause. Now, let's flip over to the bacterial side. While it's less common overall, it's a huge deal for kids. We're talking up to 75% of their cases. It's typically caused by everyday bacteria, like staph and strep. Oh, and here's a big one. If you wear contact lenses, you should really pay attention, because your risk for this type of infection is higher. Now, most bacterial cases are pretty easy to treat, but there is a much more serious form that we absolutely have to talk about. It's a chronic infection called trachoma, and its consequences can be devastating. I mean, just let this sink in. Trachoma is the single leading preventable cause of blindness on the entire planet. It's caused by a specific bacteria and leads to repeated infections that, over time, cause horrible scarring on the cornea. It's a stark reminder that while we often think of pink eye as a minor annoyance, some forms are incredibly serious. So, with all these different causes, from a simple cold virus to a sight-threatening bacteria, you can bet the symptoms are different too. So how can you even begin to tell what you might be dealing with? Let's look for some telltale clues. Okay, the biggest giveaway is often the discharge. A bacterial infection usually comes with a thick, yellow-greenish goop that can make your eyelids feel gummy or even get crusted shut when you wake up. Ugh. Viral infections, on the other hand, tend to be more watery and clear, and they give you that classic sandy or gritty feeling, like there's something stuck in your eye. So, while those symptoms are really great clues, trying to diagnose yourself isn't always the best idea. It can get tricky. So how do doctors get the official verdict and figure out what's really happening? Well, a doctor's diagnosis is a pretty logical process. It all starts with your story. When did it start? What does it feel like? Is anyone else at home sick? Simple stuff. Then they'll do a quick vision check to make sure everything's still sharp. The really important part is the eye exam, where they use magnification to get a super close-up look. And if the case is really bad or just won't go away, they might take a little swab for a lab test to identify the exact bug causing all the trouble. So once you have a diagnosis, it's time for the action plan. Let's look at the different ways to handle conjunctivitis and, most importantly, start feeling better.
The goals for any treatment are really straightforward. Number 1, improve your comfort and get some relief. Number 2, if it's an infection, fight it. And number 3, which is so important for the contagious types, stop it from spreading to your other eye or to other people.
So what can you actually do? Well, at home, simple things can make a world of difference. Gently washing your eyelids and using warm compresses can help clear out all that crustiness from a bacterial infection. But for a viral case, cool compresses usually feel way better and can soothe that irritation. Now, medically, the treatment is very targeted. Antibiotic drops are for bacterial infections, while most viral cases just need time and supportive care while your body fights it off. Yeah, for a standard bacterial infection, a week or so of antibiotic drops will usually clear it right up. And like we said, viral cases just have to run their course. But for some of the more serious types, the treatment is way more specific and urgent. I mean, look at gonococcal conjunctivitis. That's a medical emergency that needs an injection fast. And that right there is why getting a proper diagnosis from a doctor is so incredibly crucial. So the next time you or someone you know gets that infamous red eye, you'll have a much better idea of what might be happening behind the scenes. Is it just a little irritation, or is it a full-blown contagious infection? You now have the clues to start telling the difference, and more importantly, to know when it's time to stop guessing and actually call a doctor.